Ever had a toothache that made your ear hurt? Or shoulder pain that showed up during a heart attack in someone in family? Sounds like your body's GPS is way off, right? Welcome back to DocDecoded, where we decode health one myth at a time. Today on DocDecoded, we're cracking the curious case of referred pain, where your body sends out pain signals to the wrong address. Like, share, and subscribe if you want to know more about your health and diseases in the DocDecoded channel. We feel pain because special nerves detect damage or danger, like a cut, burn, or injury, and send signals to the brain. The brain then creates the feeling of pain, so we know to stop, protect the area, or seek help. It's like an alarm system to keep us safe and prevent further damage. Pain is the most common reason people visit a doctor because it signals something might be wrong in the body. The main job of the pain system is to protect us by detecting and alerting us to possible or actual damage, helping the body stay balanced and healthy. Different diseases cause different types of pain, and doctors use these patterns, where the pain is, how long it lasts, and how it feels, to figure out what's causing it and how to treat it quickly. What if that pain itself is confusing? If nerves were employees, referred pain would be the intern who sends your urgent email to the wrong department. Hey, the gallbladder's freaking out. And your shoulder gets the memo. Pain itself is an unpleasant feeling that can be sharp, burning, or squeezing, and it often triggers strong emotional reactions like fear or nausea. When pain is intense, it usually brings anxiety and a strong desire to make it stop. This shows that pain is both a physical sensation and an emotional experience. Acute pain means those severe pain which start within a short period of time. For example, heart attack, appendicitis, injury, and many more. Such pain causes physical stress responses like higher blood pressure, increased heart rate, wide pupil and tense muscle, and other signs. Did you know? Your brain has no pain receptors, so technically, brain surgery can be done while you're awake, which is great news for people who want to live tweet their lobotomy. Just kidding, please don't. Let me know in the comment section what lobotomy is, by the way. So what exactly is referred pain? Imagine this. You stub your toe, but instead of pain in your foot, your earlobe starts throbbing. Okay, that's not a real example, but referred pain works similarly. Pain is felt in a part of the body different from the actual source. A classic example, a heart attack causing pain in the left shoulder or jaw, not just the chest. Why does this happen? Well, our nervous system isn't always great at playing pin the tail on the donkey. Sometimes, nerves from different areas share the same communication line in the spinal cord. So when the brain gets the pain signal, it guesses where it's coming from, and it doesn't always guess right. Have you ever felt pain in one spot, but the doctor told you the problem was somewhere else? Let me know in the comments. I'm curious how sneaky your body has been. Let's decode a few real-world examples of referred pain. Some might surprise you: in heart attack or myocardial infarction. Pain isn't just in the chest. It can radiate to the left arm, jaw, neck, or even back. In women, it may show up as nausea, dizziness, or fatigue instead of the elephant on the chest feeling. Gallbladder issues. Gallstones or inflammation can cause pain in the right shoulder or between the shoulder blades. The gallbladder is located under your liver, but that ache often shows up nowhere near it. Kidney problems. Kidney stones or infections often cause back pain or pain in the groin area. But rarely do people say, "Hey, my kidneys hurt." Diaphragm irritation. This can lead to pain in the shoulder, thanks to the phrenic nerve, which gets confused about where the signal is coming from. Pancreatitis. Pain from the pancreas, located deep in the abdomen, often radiates to the back, especially the upper back. It may feel like a dull ache that worsens after eating. Appendicitis. Early pain often starts near the belly button, periumbilical region, before settling in the lower right abdomen. The initial referred pain is due to visceral nerve supply. Liver disease. While the liver is in the upper right abdomen, inflammation or congestion can cause right shoulder pain due to irritation of the diaphragm, again involving the phrenic nerve. Spleen rupture, Kehr's sign. An injured spleen can cause pain in the left shoulder. This is a classic referred pain scenario due to diaphragmatic irritation. Ectopic pregnancy. This means that the embryo is developing in a region which is not normal site of implantation of embryo. A ruptured ectopic pregnancy may cause shoulder pain due to blood irritating the diaphragm, another case of Kehr's sign. Here are a few more, lesser known but clinically relevant examples of referred pain. Aortic dissection. This life-threatening condition can cause sudden, tearing chest pain that radiates to the back, often between the shoulder blades. Bladder or prostate issues. Pain from the bladder or prostate can refer to the lower back, perineum, or even the inner thighs. Patients may also feel vague pelvic discomfort. Ovarian or uterine pain can be referred to the lower back or thighs. For instance, endometriosis or ovarian cysts often present with pelvic pain radiating to the lower limbs. Testicular torsion. While the pain is usually in the scrotum, it can sometimes refer to the lower abdomen or inguinal area, mimicking appendicitis or hernia. Lung and pleuritic pain. The lower lobe of the lungs or pleura can irritate the diaphragm and refer pain to the shoulder or upper abdomen. For example, a lower lobe pneumonia may present with abdominal pain. Esophageal pain. Disorders like esophageal spasm or severe reflux can cause chest pain radiating to the back or jaw, again mimicking cardiac pain. Cervical spine issues. Herniated discs or cervical spondylosis can cause referred pain down the arm. Radiculopathy, often mistaken for shoulder or cardiac issues. Tension headaches or TMJ disorders. These can refer to pain in the neck, shoulders, and even the upper back. Bowel obstruction or severe constipation. These can sometimes refer pain to the back or flanks due to bowel distension. Which of these examples surprised you the most? Or have you had a weird pain that turned out to be something totally unexpected? Drop your story below. Okay, now we get to know that referred pain is basically the nervous system's prank. But how do doctors figure out what's really going on? A history taking. The first clue often comes from your story. Where the pain is, what triggers it, and how long it lasts all help point toward the source. 2. Physical examination. Is there tenderness where the pain is? Is there any other symptoms like fever, nausea, weakness, or other symptoms? Do you know what's the difference between pain and tenderness? Let me know in the comment. 3. Diagnostic tests. Depending on suspicion, doctors may order ECGs, ultrasounds, X-rays, or even MRI scans to hunt down the true culprit. Here's an example. Someone comes in with right shoulder pain. No injury, no muscle strain. But they also feel nauseous after eating fried food. Boom! Doctor suspects gallbladder issues. The gallbladder, while only about the size of a lime, has caused more drama than a season of Grey's Anatomy. All over a stone the size of a grain of rice. Would you trust your gut feeling or shoulder pain if something didn't feel right? Ever had a weird symptom that turned out to be serious? Why it matters. Don't ignore referred pain. Referred pain isn't just a cool medical fact. It can be life-saving to recognize. People often ignore shoulder or jaw pain, chalking it up to stress or posture. But sometimes it's your heart waving a red flag. Or they think back pain is just bad posture when it's actually a kidney infection or an abdominal aneurysm. Yup, that escalated quickly. Rule of thumb, if you've got unexplained pain, especially if it's sudden, severe, not going after taking painkillers, or comes with other symptoms like fever, dizziness, nausea, or shortness of breath, don't wait. Get checked out. How can you suspect something different in these referred pain? Always look for other probable abnormalities or signs and symptoms in your body. Maybe in the milder form, apart from the pain, which often overweight and overshadow other symptoms. For example, for right shoulder pain, observe your digestive system for the last 3 to 6 months. Nausea, appetite, bowel habit, etc. For left shoulder pain, look for your respiration comfort, swelling, palpitations, fatigability. For pelvic pain, you should look for bladder habit and flow. Ignoring referred pain is like ignoring your fire alarm because it's probably just the toast. Sure, until the kitchen is on fire. Recognizing referred pain can help spot serious conditions like heart attacks, gallbladder disease, or kidney problems. Don't ignore weird or unexplained pains. They might be your body's version of Morse code, and it's best not to leave those messages unread. What symptoms would you like us to decode next? Is there a body mystery you've been wondering about? Maybe random leg cramps at night? Chest tightness during anxiety? Drop your suggestions below and help us pick the next topic. And also, do not forget to like, share, and subscribe. Until next time, stay curious, stay healthy, and don't let your body play hide and seek with your symptoms. This is DocDecoded, decoding health, one symptom at a time.